case of 55 years old lady who presents with loss of vision in the left eye 2 days after heavy lifting at her gym. Her acuity was bare 660 and was phakic. She had macula of retinal detachment secondary to posterior temporal giant retinal tear with associated mild vitreous hemorrhage. 5 gauge plus vitrectomy surgery was performed. After removal of the vitreous hemorrhage, intravitreal kinocort injection was used to identify the posterior high-load face. Attention was given to excise all remaining vitreous and membranes anterior to the anterior flap of the giant tear. Vitrectomy was performed to the vitreous base by intravitreal injection of perfluorooctane heavy liquid bubble, which was expanded slowly to reach up to the posterior edge of the giant tear. Fluid exchange was performed with the tip of the extrusion cannula placed close to the giant tear to ensure aspiration of all the subretinal fluid posterior to the tear. This was helped by a scleral indentation posteriorly. Then the remaining fluid was slowly aspirated, ensuring the giant tear anterior and posterior flap are approximated without slippage and avoiding entry of the heavy liquid under the retina. After removal of all the fluid, the heavy liquid bubble was gradually aspirated. Small BSS bubble was used to ensure complete removal of the heavy liquid. Laser was applied in 3 rows around the giant tear, followed by 360 peripheral laser. Air silicone oil 1000 centistoke exchange was then performed to obtain complete fill of the vitreous cavity with oil. After checking the eye pressure, the ports were removed with no sutures to the scleral ports.